concentrate, dominate, and innovate.
Thank you. Good morning. My name is Claudia Harner-Jay, and I work for PATH, a global health organization in Seattle. And to begin, I want to tell you a story that has long fascinated and inspired me and ultimately changed the direction of my career, leading me to work in global health. As many of you know, the first part of the 20th century saw the development of several key vaccines: diphtheria, pertussis, tetanus, measles, polio. And all of these diseases were previously common killers of children globally. In the late 1970s, the World Health Organization partnered with UNICEF to vaccinate every child in the world against these lethal diseases for which there are now vaccines. The tricky thing about vaccines, however, is that many of them are heat sensitive, and they require a cold chain to maintain product potency during transport and storage. Exposure to hot temperatures outside that recommended range destroy a vaccine's effectiveness and compromise a child's protection against the disease. When the WHO and UNICEF set out to vaccinate every child in the world, no global immunization supply system existed or related cold chain. So they built one in collaboration with country governments. But this was, as you can imagine, no small task. It was full of complexity and laden with challenges. And in the early years, despite best efforts, breaks in the cold chain were high in areas where power outages and gas shortages interrupted temperature controls, or where outreach to remote populations required vaccination teams to travel by foot or by motorbike. While healthcare workers did the best they could with the information they had, they just had no way of knowing if a vaccine had become too warm during its long journey from that European vaccine manufacturer to a remote village in, say, Central Africa. So they erred on the side of caution, following very conservative disposal guidelines, but still throwing away a lot of good vaccine, which, as you can imagine, was very expensive for UNICEF and very frustrating for families who came to the immunization clinic only to be told to come back in a month because of an unanticipated stockout. Following a call to action, my organization, PATH, launched a search after WHO put this call to action out for suitable technologies to monitor the heat exposure of vaccines so that vaccine workers would know whether to use or discard vaccine. And we came across a really interesting technology by a company named TempTime. It had originally been created for the food industry to monitor perishable food products. And we wondered, could this be adapted for use with vaccines as well? With funding from the US Agency for International Development, we worked with TempTime to do just that. And the result was the vaccine vial monitor, also known as the VVM. It's a small adhesive sticker that's placed on the vaccine vial or label. And the VVM changes color and becomes darker as it and the vaccine are exposed to heat. And thus, now at a glance, a healthcare worker knows whether she can use that vaccine and administer the vaccine to a child, or she needs to throw it away. These VVMs, by the way, indicate that the vaccine is still good, given that sticker is still lighter in color. Today, all vaccines that are procured by UNICEF and Gavi, the Vaccine Alliance, must include VVMs to ensure that only potent vaccines are administered to children through standard immunization programs, ensuring that children worldwide are protected fully against vaccine-preventable diseases. Since this product has been commercialized, over 5 billion VVMs have been used and has saved the global health community over $14 million a year in avoiding the unnecessary discard of vaccine. So what did it take to transform a technology used to monitor perishable food products into an innovation that's a key part of the global immunization supply system today? Well, it took locating a potential technology in its original food monitoring format, partnering with the product developer to adapt it for use with vaccines. collaborating with UNICEF and Gavi, the Vaccine Alliance, to facilitate supply of the VVM on all vaccines, making the case for product adoption and use to the vaccine manufacturers, and finally, training healthcare workers to read and react to those VVM results. Think about all the participants in this solution that had to work together. None alone had either the know-how or the incentive to make any of this happen on their own. Collaboration is key. Keep this VVM story in mind as I invite you all to ponder with me. What is innovation in the context of global health? Where does innovation come from? And what from this story can be learned and applied to other global health initiatives? My organization, PATH, focuses on these questions. And for nearly 40 years, we've been developing and translating bold ideas into transformative solutions for people in low-resource settings. And successes and lessons learned from projects like the VVM during past history have really contributed to our perspective on what it takes to leverage innovation for impact. And I'm going to get back to how we're applying those lessons learned in a more systematic way at the end of my talk. But first, I want to speak to why the cultivation of innovation matters in global health. So why is innovation needed in global health? First, I want to say that since PATH's establishment in the mid-1970s, remarkable gains have been made in global public health, especially for women and children, and especially for women and children in developing countries. The number of children dying before the age of 5 has dropped by almost half from 1990 to 2013, from 13 million to 6.6 million. And the number of women dying from complications during pregnancy and childbirth has also declined by half. And these improvements have been largely driven by innovations, drugs, vaccines, devices. But there are still far too many women and children dying from preventable conditions. And every 5 seconds, somewhere in the world, a child under 5 dies, mostly from preventable diseases like pneumonia and diarrhea, and mostly in developing countries. We can do better. And PATH is focused on preventing these deaths by finding, curating, and scaling up technologies to save lives. But it's really challenging work. To better understand the challenges in deploying new technologies in low-resource settings, I want to give you another example, this time in the area of household water treatment. One of the most serious problems in the developing world today is access to safe drinking water. And this year alone, contaminated drinking water will cause or contribute to up to 1 million deaths globally. Home water filters can help solve this problem, but there's a big difference between designing a functional water filter and a water filter that people will actually use. In 2007, PATH explored water filters and other water treatment technologies as part of its Safe Water project. We spent more than 600 hours in 5 countries, including Cambodia, observing how families use water treatment products. In Cambodia, diarrheal disease is a leading cause of death for children under 5. And research showed that ceramic water pots that filter water had been sold or given away for a decade, but only 6% of the population was using them. To have an impact, the filters need to be durable, affordable, and effective, and they were. So the question was, why weren't people using them? Working with end users, we learned that the filters could be difficult to assemble, that they were not at the right height for a standard-sized cup to fit under that tap. People thought the filters were really ugly, and they didn't want to use them. They said, this looks like a garbage bin. I don't want to drink water from a garbage bin. And people wanted an aesthetic design that would fit into their homes. But the more modern water filters out there, they just didn't cut it. They were just a little too fancy. These key insights informed a filter redesign. And you can see here that we created a platform so that a cup could easily fit under that tap. We also created a more aesthetic design, which actually the end users chose from a variety of different options. And thus, the end users were the source of ingenuity, helping to create better water products for their families. PATH worked with a Cambodian manufacturer, Hydrologic Social Enterprise, to manufacture and market this new product. We also worked with a microfinance lender, Vision Fund, in Cambodia to provide loans for these $20 products. So what impact did these efforts have? The improved ceramic water filter outsold that original design 17-1. 80% of households who purchased the red ceramic water filter were still using it correctly and consistently a year later, which means that more people are drinking safer water. We consider PATH's approach in Cambodia a multidimensional success. Not only has the use of ceramic water filters increased, helping to protect children and families from waterborne disease, but because the venture is financially sustainable, the two private sector organizations involved in this endeavor see value in driving future innovations on their own. Reflecting on the lessons learned from these examples, we see that the vaccine vial monitor and the ceramic water filter are two cases that underscore how fresh thinking and new ideas can come from many different places. Sometimes, key technologies exist in the world, and we need to adapt them for use in low-resource settings. Sometimes that source of inspiration comes from the end users, who are fabulous co-designers. Sometimes eye-opening experiences happen from a field trip on the ground, and something sparks an idea in our product development shop or our lab, or perhaps that spark is ignited in somebody else's lab halfway across the world. But whatever that source of inspiration, the journey of innovation requires an open mind, attention to detail, perseverance in the face of challenge and adversity, and cross-sector collaboration to achieve impact at scale. In my last few minutes, I want to tell you about how we're applying these lessons learned to the Innovation Countdown 2030 project, which seeks to both identify and promote high-impact solutions that can transform global health by 2030. We drew from our decades of experience in sourcing and curating, ensuring that there was broad input from the global health community and also cross-sector collaboration. And by raising awareness of these innovations, we aim to spur action, ultimately to increase the impact of precious financial resources. And we've adopted a three-step process. First, we crowdsourced innovations from around the world. As we've seen, innovation can come from many different places, and we encouraged anyone with an idea to submit it. Second, we created a rigorous methodology to assess the proposed innovations and to help us down-select to a more manageable number for further evaluation. And the third phase of the curation process, which is where we are now, entails an independent panel choosing which innovations to showcase. Our call for innovations last fall resulted in 500 ideas from 46 countries. And ideas came from a wide spectrum of people: NGOs, technology developers, social entrepreneurs, and various academics. And the ideas included some really interesting things, like rats trained in how to smell tuberculosis in sputum samples, and new diarrhea treatments for children, as well as a paper microscope that can detect the malaria parasite. Crowdsourcing is really good for raising awareness of ideas that might otherwise be overlooked, but the output requires curation to further narrow that field of submissions. Our curation framework assessed a variety of different factors, including the potential for health impact and the stage of development, as well as the potential for affordability and scalability and accessibility. And it helped us to narrow the field to 175 innovations from those original 500 that came in. Finally, once those ideas have made it past the initial curation process, an independent panel of experts will review the ideas and choose the 30 that we will showcase. These innovations and other findings from this project will be released this summer at the Financing for Development Conference in July in Ethiopia, where world leaders will be coming together to discuss how to pay for the new 2030 Sustainable Development Goals. And we're working to ensure that Innovation Countdown becomes an annual effort so that we can track progress and challenges of high-impact innovations until those 2030 goals are met. In closing, we're inspired by both the innovation and the passion from people all over the world in all walks of life. Innovation comes from many places, and by broadening engagement and increasing collaboration, we can further improve that focus that we bring to interventions that have the highest potential for impact. We believe this process will accelerate transformative change so that all people everywhere have the opportunity to achieve their full potential. Thank you.